Hello everyone, how are you today? I'm Dr. Paramjeet and you're watching Dr. Education. Welcome back to my channel. As you know, I make videos about health and healthcare topics, and today I'm going to talk about urinary tract infections. And as you know, all my videos are directly referenced from internationally accepted US National Medical Library. And today we are going to talk about UTI in adults, right? It's a very common problem. Almost everyone has faced UTI at least once in their lifetime. So let's find out what causes UTI, how it is diagnosed, how it is treated in medical science. 100% scientific knowledge, very authentic. Let's go into it.
The internet is full of bro science, fake knowledge, half information, or propaganda. Your quest of reliable, authentic health information ends here. So subscribe this channel and hit the bell icon, and you never have to go anywhere else ever again.
So a urinary tract infection or UTI is basically an infection of the urinary tract, which means the infection can occur anywhere in the urinary tract. That means including either it might be in the bladder, right? Bladder is your urinary bladder. This infection in the bladder is called cystitis also, or bladder infection. It might be in the kidneys, in which it is called pyelonephritis or a kidney infection. It might be in one or both kidneys. It might be in the ureters, that those are the tubes which bring the urine from the kidneys to the bladder, and these are ureters, right? But these are very rarely the only site of infection, right? There will be some other infection in kidneys or bladder as well. And then infection can be in the urethra. Urethra is the tube that empties urine from the bladder outside the body. This infection is also called urethritis. Okay, so what causes UTI? Most UTIs are caused by bacteria that enter the urethra and then the bladder, that way. All right, the infection most commonly develops in the bladder. This can then spread into the kidney, and most of the times your body can get rid of this bacteria very easily. However, certain conditions increase the risk of having a UTI. Women tend to get them more often because their urethra is shorter and closer to the anus than the men. All right, that's why unhygienic conditions can occur more easily. Because of this, right, they are more likely to get infection even after sexual activity or when using a diaphragm for birth control. Also, right, menopause also increases the risk of UTI in women. That's why it's more common in women, right? UTI can occur more often. You might increase the chances of having a UTI if you have diabetes, if you have advanced age, and or conditions that affect your personal care habits such as Alzheimer's disease, delirium, or if you have problem emptying the bladder completely, if you have a urinary catheter, bowel incontinence, enlarged prostate, or narrowed urethra, or anything that blocks the flow of urine, like a kidney stone, or if you are staying still or immobile for a long period of time, for example, while you are recovering from a hip fracture, or even in pregnancy, or surgeries like other procedures, or other even any surgery procedure involving the urinary tract. All these situations, you might have an increased risk of having UTI. So what happens when you do have UTI? See, first of all, obviously, you will have a cloudy or even bloody urine, which may have a foul smell or even a strong odor, right? You might have low grade fever. In some people it doesn't happen. Then pain and burning will be there with urination, and pressure or cramping will might be there in the lower abdomen or even the back, lower back. There will be a strong need to urinate very often. Even right after bladder has been emptied, you might have a strong need for urination. And if the infection spreads to your kidney, the symptoms may increase, like you might have chills and shaking, right? Or even night sweats. You might have fatigue, generalized feeling of illness. You might have fever, high grade above 101 degree Fahrenheit or 38.3 degrees centigrade. There might be pain in the sides, back out or the groin, right? That kidney region. Or you might have reddened, flushed, warm skin. Even mental changes can happen, confusion can happen as a sign of UTI, right? In older people, especially in older people, that's the only sign most of the times. Then nausea, vomiting can also happen. You might have very bad abdominal pain sometimes with the infection going into the kidney. Now, how do we diagnose? See, most of the time you will need to provide a urine sample, right? Because urine analysis is very important. It is done to look for white blood cells, red blood cells, bacteria, pus cells. Basically, then we can also test for chemicals like nitrites in the urine. This test can diagnose the infection most of the times. Then a clean catch of urine is needed for cultures, right? This test cultures is done to identify the bacteria and determine the best antibiotic for which the bacteria is most sensitive, or even to isolate the antibiotics which the bacteria is resistant to, so that we might have the best chances of treatment, right? Then blood tests such as CBC, complete blood count, blood cultures can also be done. You may also need some other tests to rule out other kinds of problems in your urinary system, like a CT scan of your abdomen, sometimes IVP, intravenous pyelograms, kidney scans, kidney ultrasounds, right? Voiding cystourethrogram, something like these may be advised, not always, but sometimes. Then what is the treatment? Most important thing. Your doctor will first decide if the infection is just in the bladder or if it has spread to the kidneys, and how severe is this. If there is an infection only in the bladder, mild infection in the bladder, and even if there is mild infection in the kidneys, most of the time you will need to take antibiotics. This is to prevent the infection from spreading the kidneys also, if it hasn't spread there. For the simple bladder infection, you will take antibiotics for 3 days for women, and for men, 7 to 14 days antibiotics are needed. Yeah, that's the thing. Longer urethra, more antibiotics. If you are pregnant or having diabetes or have a mild kidney infection, you will most often take antibiotics for 7 to 14 days. Finish off all your antibiotics, and then even if you feel better, don't stop your medicine. Finish your whole course, right? If you do not finish the whole dose of medicine, the infection may return, and next time it will be harder to treat. That's why there are recurrent UTIs more in many people. So then always drink plenty of water when you are having a bladder or kidney infection, right? Tell your doctor if you're pregnant, that's most important, or if you're taking any other drugs or medicines. Then if you have a recurrent bladder infection, right? These that happens in some women who have recurrent infection, then you have to take a single shot of an antibiotic after sexual contact to actually prevent infection. This is actual recommendation. A single shot of an antibiotic after every sexual contact to prevent an infection. You might have to have a 3-day course of antibiotic at home to use if you develop an infection, and to take a single daily dose of antibiotic to prevent infection for some time, right? Then if you have a very severe, more severe kind of kidney infection, then you may need to go to a hospital, and if you're very sick, cannot take medicines by mouth, or if you cannot drink enough water, fluids, then you need to be admitted. If you are an older adult, then it's very important that you have your, or if you have a kidney stone or changes in your anatomy of your urinary tract. Something has happened, stricture is there, some pressure is there, compression is there, swelling is there. So that is not good sign, right? Then even that time you have to get admitted. If you have had recent surgeries of urinary tract, or have a cancer, diabetes, have multiple sclerosis, spinal cord injuries, or other medicinal procedures, if you're pregnant and if you have a fever, or if you feel otherwise ill, then also you should consider getting admitted. At the hospital, you will receive IV fluids and antibiotics through the vein, right? And some people have UTIs and that do not go away, right? And that means that it will keep on coming back. It will get treated, then keep on coming back. These are called chronic UTIs, right? If you have that, then you need stronger antibiotics and you need to take them for a long time. You may also need surgeries if the infection has caused a problem with the structure of the urinary tract. So remember, the best doctor for this kind of situation are urologists. There are specific urologists now. All right. Then most UTIs can be cured. Don't worry about it. Bladder infections, and if you have those symptoms of bladder infection, they will go away within 24 to 48 hours after the treatment begins. But do not stop your medicine. And if you have kidney infection, this will take approximately 1 week or longer for the symptoms to go, right? And if you stop infection, don't take treatment, then you might have complications. And mind well, urinary tract infections can have life-threatening complications as well. It might lead to sepsis, right? The risk is greater among the young or very old people and people whose body cannot fight infection, especially like people who are fighting with cancer, HIV, AIDS, or who are immunocompromised, right? Then if you have actual kidney damage, right, that might happen as a complication. Kidney scarring can happen, right? Renal tubular infection, sorry, renal infection can become serious, right? So that is one. You can have pus collection in the kidneys as well. Then that's why it is very important, if you have back pain, side back pain, chills, fever, vomiting, any kind of burning in your urine, then go to a doctor. Okay. Is there any way to prevent UTI? Then diet and lifestyle may actually prevent UTI. After menopause, if you're having, like, if a woman has menopause, the woman may use estrogen creams around the vaginas to reduce the infection. Yes, and that's the only thing. And a lot of water. You need to take a lot of water, good amount of salads and fruits, right? That will help prevent UTIs. Managing your weight, keeping a hygienic, hygiene over that area is also very, very, very important, right? So that's all about UTI, guys. Hope this video is helpful. I am Dr. Paramjeet. You're watching Dr. Education. Always subscribe, share my videos, always like my videos, and don't forget to, keep sharing, promoting this channel. It's your channel, right? All you need to do to stay connected is stay healthy, right? Take care.